Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Aspiration pneumonia. Introduction. Aspiration pneumonia is an infection of the lungs caused by inhaling food or liquid into the lungs. Pneumonia may result when people who aspirate food or liquid can't cough them out. Aspiration pneumonia can be dangerous. It can result in lung scarring and abscesses. It can also be fatal if not treated early. This program discusses aspiration pneumonia. It explains its causes, symptoms, and treatment options. Aspiration. Food and liquid that are ingested go from the mouth to the throat and into the esophagus to the stomach. In front of the esophagus is another tube that takes breathed air to the lungs. This is the trachea. When we swallow, the trachea closes and the food and drink go into the esophagus. Under certain drugs or medical conditions, the trachea fails to close adequately, and swallowed food or liquid can enter the trachea. This is called aspiration. When we aspirate food or liquid, our body usually coughs to push the food out of the trachea. However, sometimes coughing isn't enough, and the aspirated materials go to the lungs, which may cause inflammation, infection, or both. The liquid and solids that can go accidentally into the trachea include food, saliva, vomit, and any substance other than air. Causes. Aspiration is caused by inhaling materials other than air into the lungs. Bacteria in the aspirated materials cause pneumonia infection. The body's immune system fights such infections, but it may lose the battle, particularly when the person has a weakened immune system from sickness, aging, or medication. Patients under general anesthesia may aspirate vomit, which explains why patients are asked not to eat or drink for at least 8 hours before their procedures. Some people have trouble swallowing or coughing because of neurological conditions such as stroke, brain injury, Parkinson's disease, coma, or multiple sclerosis. People in nursing homes are more likely to have aspiration pneumonia. Some medical, recreational, and illicit drugs can cause drowsiness and difficulty swallowing. Eating too fast, mouth sores, acid reflux, and dental problems can also cause aspiration. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Usually, healthy people notice when food or liquid other than air enters their airways and start coughing. They feel something is stuck in their throats. When the patient is weak, sedated, or drowsy, they will not notice the aspiration. Symptoms start within an hour and may include chest pain, shortness of breath, and wheezing. Within a day or two, pneumonia infection symptoms may start, including coughing blood, fever, chills, sweating, and bad breath. This is known as aspiration pneumonia. If you have chest pain, fever, or difficulty breathing, call your healthcare provider and seek emergency medical help. Pneumonia develops fast. Diagnosis. The healthcare provider will take your medical history and perform a physical examination. Be prepared to answer questions about your symptoms and what has happened. The healthcare provider will order tests such as X-ray, CT scan, blood tests, sputum test. Sputum, or phlegm, is a sticky, coughed substance. If the cause of aspiration is a medical condition, your healthcare provider may order swallowing studies and refer you to a specialist. Treatment. Bacteria cause aspiration pneumonia and are therefore treated with antibiotics. Your healthcare providers may give you oxygen therapy. In case of severe symptoms and risk of death from infection, your healthcare providers may order mechanical ventilation, where a machine helps you to breathe. Most people who get aspiration pneumonia and get treatment will survive. Most people will recover from aspiration treatment in about a week. However, it may take a month before they regain their full strength. If you are hospitalized, follow the discharge instructions explaining how to care for yourself at home and avoid future aspirations. Prevention. The following are things you can do to reduce the risk of aspiration. Eat when you are alert. Avoid food when you are drunk or drowsy from drugs. Avoid sticky food like caramel and toffee. Cut food into small pieces and add sauce or water to moisten dry food. Stay upright when you eat and chew slowly and thoroughly. Avoid talking as you chew and swallow. Swallow before taking the next bite. Take care of your teeth. If you have dentures, use them as instructed. Manage your acid reflux and canker sores.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Aspiration is when food or liquid enters the lungs instead of the stomach. Aspiration pneumonia is a lung infection because of bacteria in the aspirated materials. People who are drowsy because of drugs or have neurological conditions are more likely to experience aspiration. You should contact your healthcare provider immediately if you have chest pain, fever, and difficulty breathing. Healthcare providers prescribe antibiotics to treat aspiration pneumonia. Treatment is successful for most people. To avoid aspiration, stay upright when you eat and chew slowly and thoroughly. If the cause of your aspiration was a medical condition, your healthcare provider will refer you to a specialist. Thank you for using Explain.